Hey, CEimpact subscribers, welcome to the Game Changers Clinical Conversations podcast. I'm your host, Josh Kinsey, and as always, I'm excited about our conversation today. Sexually transmitted infection rates are climbing, and access to timely testing remains a major barrier for many patients, making over-the-counter STI kits an important new tool in public health. In this episode, we'll explore what pharmacists need to know to support patient use, answer questions with confidence, and help expand access to sexual health care. It's so great to have Elizabeth Skoy as our guest today. Elizabeth, welcome.
Thanks, Josh. It's
It's
great to
great
be
to
here.
have, yeah, great to have you. Thanks for taking time out of your summer break. As I always joke, as I remember as a faculty member, summer break was not really summer break. It was
No, it
put your
is
head
not
down
summer
and get
break.
stuff
Right.
done.
Yep,
Yep.
exactly.
But thank you. I know you're very busy, so we appreciate it. Elizabeth has done a lot of work with us on lots of projects over the years, so we're just super excited to have you on a podcast. I haven't had you as a guest before. So um, on that, go ahead and take a couple of minutes, Elizabeth, to introduce yourself to our guest for those that may not know you yet.
Yeah, thanks so much. Hello, everyone. So, I'm Elizabeth Skoy. I am a practicing community pharmacist, and I also am a faculty member and professor at the North Dakota State University School of Pharmacy. And then I also serve as the director for the Center for Collaboration and Advancement in Pharmacy. Between my teaching, I teach in a skills laboratory, so teach a lot of that hands-on, how to type. I teach a point of care testing elective. And then, of course, work with pharmacies to implement, point of care testing, test to treat, providing education basically on pharmacy practice. And so, yeah, this is a really exciting topic and exciting time in the world of, at-home testing and devices. And so it's great to be here to talk with you guys about this.
Awesome. Thank you so much. Well, without further ado, let's go ahead and move into the content for today. And let's talk. I always like to level the playing field, just make sure that we all know what we're talking about for today's episode. I gave the segue earlier, but let's just go ahead and specifically nail down what we mean when we say OTC STI kit. Like what what is out there? What are the purpose of these? And maybe even talk a little bit about collection sample types and things like that.
Yeah, absolutely. So, when we're talking about the STI kit, right? So, sexually transmitted infection is, we think of STI, that's what that stands for. So, we think of those tests. Up until recently, we had a number of CLIA waived tests that were available. And so they were, these CLIA waived tests that could be done in a doctor's office or even a potential in a pharmacy in certain situations where there was a sample collection, and then it's usually, that point of care test, CLIA waived, where you get a result pretty rapidly. There were a few kits out there that were maybe sold over the counter, but how that works is that they're actually not, you don't get the results right away. And so there were some kits that were for STIs that were available over the market that, you kind of did the at-home sample collection and then you would mail in your results. And so there was probably the first, I would say, over the counter test that was available for detecting an STI was HIV. So that's been around for a little while, where somebody could, and that was through either you could do either an oral swab, like a oral collection, or you could also do a blood collection for those. So that was one. And then more recently, we have a couple of other tests that have come on the market for over the counter, and that is for syphilis. And then there's one for females. It's only approved for females right now over the counter, but it's actually the first um, PCR test that was
Mm.
available over the counter. So that's kind of a new thing in itself. And then that is testing for chlamydia, gonorrhea, and trichoniasis all together.
Mm.
So those are kind of the main ones out there. And again, we've had the over-the-counter um, HIV, for a while as well. So yeah, so I think this market is really expanding. I think there's been a greater interest from some funders like the NIH and things like that to expand the types of tests that are available for public health and getting these tests to the public. And so it's a great time to see these coming available to patients so they can test at home.
Yeah. Yeah. And one thing that you mentioned, Elizabeth, I want to go back to is, any previous ones may have been some sort of send off and, the wait
Right.
response. And we know that that doesn't really make sense because
Right. Yeah.
A, you need to get treated pretty quickly to take care of things, or they could, it could become pretty negative very quickly.
Hmm.
And B, if you are infected, you run the risk of continuing to infect others and, without knowing. So that is something of concern. So the idea that these new tests are, you said a rapid response, right? Like they're pretty within
Yep.
just a few minutes or whatever.
Yeah.
So
Yep.
yeah. So I
Yes.
think
Usually
that's something
within
to
like
call
10
out.
to 30 minutes, depending upon the test.
Yeah. So with the newer ones, you mentioned two. Um, what are the collection samples for those? Like what would
Yeah.
the patients end up having to send off or
Right.
utilize?
So this is where I think, this is really pretty great for pharmacy. So of course, the blood sample and the oral, for the HIV. But then we had for the test, we also had the sample collection for syphilis, which is usually a finger prick blood sample. So the at-home test is a blood sample. It's a finger prick. And then the more recent one, the PCR test for women, for the three STIs that it tests for, that is actually a vaginal sample collection.
Mm,
And so, that's probably, not something where pharmacy is going to be collecting that in the pharmacy, right? And so
sure.
you have, some of these samples where like oral and blood pharmacies, are equipped to do that sample collection for like a CLIA waived. But some
Hmm.
of these other tests, if you're doing like a urine or you're doing vaginal collection, those samples are usually taken either in a clinic or in a clinic setting. Not always. I don't want to say. So there's some pharmacies out there that might be doing this. So then
Sure.
that's fantastic if you are equipped for that. But generally speaking, more in a
Hmm.
clinic setting. And then of course now, it can be
It's at
for home
home.
collection,
Yeah.
right?
Yeah. So with that though, and we'll get into this a little bit more, but while we're talking kind of about the introduction of these to the market and so forth, reminding our pharmacists their role in this, um, there are some restrictions as to what we can and can't talk about and guide on and that kind of thing, right? Like if there is a question about, oh, I don't understand this sample collection or I don't understand this, like it's not like they could open it on the counter and us actually do it for them. Does that make sense?
Yeah, correct. So it gets a little it can be confusing when you talk about at-home tests versus CLIA waiver tests.
Right.
So these tests have technically a CLIA waiver, but then once they've designated for an at-home test, in quotation marks, at-home test, then they become actually regulated by the FDA. So they're no longer regulated by CLIA.
Yes.
So,
You
right.
you took my question. Thank you. I realized I didn't
Yeah.
pose that question very well, but you're
I was
answering
I
it.
didn't know. I thought that's maybe where you were going.
It's
So if
exactly where I
I'm
was going.
yeah, so
You're
they're not,
answering it
yeah,
perfectly. So thank you.
right. So they're actually regulated by the FDA, not CLIA. However, there's like this big however, because we saw this a lot during the COVID
Hmm.
pandemic, right? Where once if we take as a pharmacy, right? So if I take a at-home test and I collect that sample for the patient, I then need to be operating under a CLIA waiver. It kind of comes back under CLIA, if
Mm,
that makes sense. So
hmm.
I can instruct a patient how to do it themselves, but if I am doing any sample collection or if I'm actually interpreting the test for them, then per the Health and Human Services, they say, well, that then goes and falls back under CLIA because
Mm,
I, as a pharmacist, am using my clinical expertise and it's kind of going away from that at home
hmm.
classification.
Yep.
So yeah, so there are so what we can do as a pharmacist is there's a lot we can do. So exciting, we can talk about this, and I think that's why this is an exciting podcast for our viewers. is that the first thing that we can do is we can be just knowledgeable about the test, right? And so if you have somebody who is, looking for that particular type of test, or if you want to be recommending that test, because, in certain ages of women and certain risk factors, even for men, there's annual screening is what's recommended. So if you have somewhere where you're actually recommending these for a patient, we should be knowledgeable about them. So we can recommend them, we can show them where they are, and then also answer questions for them about the test. All perfectly fine, and that's then operating under the home. But then if for some reason we would want to go further down that path, and we can talk later about, test to treat opportunities and things like that, where we would actually be potentially working under a collaborative practice agreement to prescribe that treatment, the antibiotics, to treat those upon a positive result, then that, is kind of a different scope.
Different scope.
But yeah,
Yep.
so you have to kind of understand
Yeah.
the regulations, so you know what you should be doing under the home test.
Exactly. And you read my mind, so thank you. I realized in the moment that it wasn't posed well, and then I thought, well, let me just see what she does with it, and you did it perfectly, so thank
Wonderful.
you. But one thing I want to point out again on that is my whole point was, if it does fall back on the whole CLIA thing, you have to be a CLIA pharmacy. So
Correct.
if you're going to be doing that, if you're going to step in and be like, oh, well, that's just a blood test, let me do that for you right here. Then boom, you have to be CLIA waived pharmacy. So that is what I was getting at, was being sure that you're staying within the parameters and the lines of what you're allowed to do based on, the different types of certifications that you have at your store. So that was perfect. Okay, so on that, let's go ahead and dig into what are all those opportunities for pharmacists. So you mentioned, we need to be in the know, we need to just, be able to answer general questions, be able to guide about general sample collection if we're not actually going to be the ones to do it. But let's talk about how, what are these actual opportunities? So one of the first ones I want to touch on is, let's talk about how it's expanding access, and it's able to keep timely and discrete testing, and trying to catch some of those patients who may not show up at the clinic, at the blood drawn, and say, oh, I think I might have an STI, let me get tested or whatever. So let's talk about that for just a little bit, the expanded access, the discrete, timely, things like that.
Yeah, so of course, we know the pharmacists are and pharmacies are the most accessible, healthcare provider and opportunity that patients can have in the country. And so, just access in general, you might have a patient who, depending on where they are and how much transportation access they have, they might not even be able to get to a clinic or like a public health site to get that testing done. And so, if pharmacies can just be a spot where they can get the tests, then that's just the first step, right? And so also I think that expanding that access also, where it's a more of a discrete spot. There's been some qualitative studies that have been done where patients would actually prefer to pick up their test kits from a pharmacy because unfortunately, and I don't agree with this, but unfortunately there is a stigma associated with going to like a public health or a local public health or public health department, because they look at that as the place where you go to get tested or treated for an STI. And so people don't want to be seen going into those places or things like that. And then also we know that especially this age range, when you're looking at that, later adolescent to, mid 20s of females that need to have that annual testing done, statistically, not a lot of them have primary care providers. And so where they're getting that, very regular updates and those check-ins to have that test done. So just having that access available is just having it there where patients can access the test, and then again do that in the privacy of their own home and getting those results and then acting upon those results, I think is one thing that pharmacy can definitely do and be provided about that.
Yeah. On that, you bring up a good point I want to go back to. I think you might have mentioned it, but let's reiterate. These couple of new ones that are over the counter, what are the age recommendations on that? Like who can they be sold to, I guess? Are there any restrictions?
Sure. I don't believe, I haven't actually read the full package insert of either of them. I don't think they necessarily, there isn't like an age restriction of who they can be sold to. And so,
Okay.
it's an over-the-counter product, and so anyone can really purchase the product.
Got it.
But there is, depending upon individuals' risk levels of, their own, sexual activity as well as ages, that will depend upon how frequently, they should be screening.
Hmm.
Um, and then as for the more recent test, which was, and this was the first of its kind, which has actually opened up a pathway through the FDA for other similar tests to go to market more quickly. So we might see more. So at the time of this podcast, there's one on the market, but by the time you listen to this, who knows, we might have, numerous
Multiple.
ones out there.
Hmm.
Yep, out there. But Visby Medical was the first one to release the women's, 3 STIs, the chlamydia, gonorrhea, and the trichomoniasis. So those are the 3 that are being tested under that PCR test that's at home with the vaginal sample collection. That particular test actually gives the positive or negative result, but it has an app that goes with it that
Mm.
talks the user through how to do the sample collection and how to operate the device. So that's also, an interesting take on utilizing, our
Yeah.
smartphones and tablets and technologies. And then actually it's the um, through the company's website and the information that they provide, is that actually the app is the one that provides you with the results for each
Results.
of those based off of that. Yep.
Okay.
So
Interesting.
yeah, it's an interesting take. And again, that PCR, a PCR test that's available. But
Yeah.
again, if you're ever with all these on the market too, and anytime there's a point of care test or a over the counter home test, always just read the information about the test. If the patient
Hmm.
comes with questions, the same thing I always say with glucometers, right? Like I
Yeah.
don't have in my mind how to use every
Every single one.
glucometer or
Hmm.
CGM on the market. I don't. But how many times have I been like, well, let's take a look and let's open this up and let's talk through that. And you can definitely, even under the at-home testing, you can do that with a patient. You can open
Hmm.
it up and talk them through how to do the sample collection on their own, and then have
Right.
them do that. Yep.
And that's what you were saying earlier with that still quantifies as an at-home test unless you do the sample, then it brings it back
Correct.
under a CLIA waiver. So yeah.
Right. Yep.
Um, so that's yeah, so great information. And so we talked about earlier, one of the key things for pharmacists is to be updated on the information. And you say one of the best ways to do that is to, read the package insert. But in general, if we're going to go into more of the test and treat route, so let's say that we do have a CLIA waiver and we are doing test and treat, we do have the capabilities to do that. We have it in our workflow, and that's what we're doing. What sort of, I guess, what sort of STI should we be up to date on? Like, what are the ones that we should
Sure.
make sure that we understand, know, certain treatments for, and things like that?
Yeah, so I would say probably the, more common ones that you're seeing right now, or not more common, but just, for treatment that you can do like a test to treat syphilis, is a big one on the rise right now. Same with chlamydia, gonorrhea, then trichomoniasis. So those are the, probably the main ones that are there.
Hmm.
Um, for most of the CLIA wave test, and again, like for like hepatitis C or HIV or the
Yeah.
at-home tests, for those, they're more of a screening. And so that's when you would need to, upon a positive, they'd actually need to have like a
Hmm.
confirmatory test completed.
Right. Right.
So that's not diagnostic, but the ones that I just mentioned, the previous ones, those are diagnostic. And so kind of similar with which some pharmacies and states are doing with urinary tract infection.
Hmm.
Where you do not have to necessarily collect the sample for
Culture.
that. So, right. So
Hmm.
you can do a test to treat. Again, you would need the CLIA waiver under your pharmacy. So you need a CLIA waiver through your pharmacy that you can, operate under CLIA. But if a patient comes in with a positive test from, again, we have pharmacies that have done this with urinary tract, and they can do that also with, syphilis or these other tests that I mentioned. They come in with a positive result. Then at that point, if you have a collaborative practice agreement that allows you to do so, you could prescribe an antibiotic for treatment for that.
Hmm.
So
Yeah.
that's, I think, really where pharmacy can take it a step further. So if nothing
Hmm.
else, be aware of the tests that are out there. And, when you see them, in the shelf in your own pharmacy or in the OTC aisle, I should say, or see them in the product catalog, if you're ordering your own or recommend is for that, then just be aware of what they treat, that the results are instant. They are a diagnostic. They're going to give you a positive or negative result. And then what to do upon that positive.
Mm-hmm.
So some patients are going to go to their healthcare professionals. They're going to go to healthcare provider, their doctor or their clinic or whatever. Some might call you, hey, I got a positive. Now what do I do? And if you have that CPA, you can prescribe. Or state protocol or whatever it is in your state,
Sure.
if you allow for that, right, to be done. And then some of the companies are even, one of the companies is piloting on their package like a telehealth option, so that if you get a positive, like on the box, you can pay for a telehealth consult to
Interesting.
get that prescription. So I think you're going to see a different varieties. I
Yeah.
think it's going to depend upon what's most cost effective for the patient, if it's
Mm,
covered under insurance. Um, and so, if they have a health savings account or, what payment,
sure.
things like that. So it's just depends upon what's going to be most beneficial for the patient.
Yeah, but I love the fact that so many opportunities, and like you said, it's just kind of opening the doors for lots of different things. And I not even really, I mean, if I took a minute to really think about it, I would have thought about telehealth, but that's another way to for those who are looking for a discrete test and then for looking for discrete treatment, because you're right, there is a stigma about going to public health for that, or being seen in your small town, oh, what are they going to say about me? And so yeah, so if you're looking for that still discrete treatment all the way through, I love the idea that there's a telehealth option, which just still allows you to get that treatment, turn right back around, go to the pharmacy, get that filled, just where you purchase the test. So yeah, all great stuff. I love it. And I love the fact that, again, with all of this, we're helping to reduce some of the stigma. We're making things more accessible, and we're normalizing, I hope, the idea is to normalize some of those conversations, some of those sexual health conversations with patients. And I'd be remiss if I didn't talk about here how on the rise, a lot of it is in our elderly population, in assisted living homes and nursing
Mm-hmm.
homes. That is a place where STIs are on the rise. And so, don't overlook that as being a place where testing needs to occur and treatment needs to occur. So, and discussions
Yeah.
in general about it. So, yeah,
Yeah. And normalizing it. And I think put
absolutely.
I think even just in general, at-home testing has become normalized. Like, let's all think back to
Hmm.
5 years ago. If you're listening to this, it's 2025, but maybe, but 5, 6 years ago, how many, if we took a room, would raise their hand and say, I've done an at-home test? Like, nobody probably would, right? We'd all just be like, no, never done that. Okay, now let's raise our hands. I mean, who has not done an
Yep.
at-home COVID test? I mean,
Hmm.
ever since the
Yep.
pandemic. So what happened after the pandemic is this just became so much more normalized, is
Hmm.
that people had never used one of these tests before. They had to open up and they're reading the insert and they're looking at the swab and they're, reading the little pictogram and they're following the directions. Well, now people have done that. And so now it's, oh, well,
That's easy.
it's not so,
Hmm.
yeah, it's easy. I can do
Hmm.
that. So now
Hmm.
it's not so um such a new concept, and so people have come onto that. Also, so has, like you said, the convenience factor. We live in a world where we want to do things from the comfort of our home, whether it's shopping or whether that's, instead of going out to a restaurant, you're ordering, the
Hmm.
DoorDash or whatever it might be, Uber
Yep.
Eats. And so we're getting that kind of that culture of doing things more from the privacy and comfort of your own home as well. And so this really just in general fits that patient demand.
Absolutely. And some could counter argue and say, "Oh, we're taking that role, that important role away from, healthcare in testing you and whatever." But that's where we have to morph and change with that as well, where we have to step up and say, "Okay, well now our role is education and treatment." And that's where we really need to take that bigger step next as the pharmacist, and making sure that we are setting ourselves up to do beyond the testing, but to do the actual um, discussions and counseling and then actual treatment options. So, yeah.
Yeah, and if you have I mean, again, where this can even go in pharmacy as we're talking about this, and I'm thinking a really big thing pharmacies have been doing more as well across the country is oral contraceptive prescribing.
Hmm.
And so
Yep.
this really fits in. It's that age range, typically
Yep.
females that we're prescribing oral contraceptives for that are coming to the pharmacy, maybe because they don't have a primary care provider. And
Hmm.
guess what? What a great opportunity for us to say, oh, by the way, just with your age, and if you are sexually active, you should have
Hmm.
one of these every year, and we sell them, and I can answer questions for you. Or maybe you have a
Absolutely.
handout in your pharmacy. You know what? In the one of the pharmacies that I used to work at, I used to have a handout every time I would, if somebody would come in for certain types of medication, I would usually provide them with some education and then also give them just something to take home to read about
Yep.
that topic of an STI and how frequently to be tested and where they could be tested. That was way
Absolutely.
before, obviously, we have these great at-home tests now. So
No, that's
it's a great
great. It's
opportunity for us.
great call outs. Yeah, great points. And again, especially like think about where you're located. Are you located where there's not a lot of access to public health or to clinics or, minute clinics or, whatever? Or are you located in a college town or university town? Because again, we see with that population, they typically don't have a PCP, and so they're usually taking care of themselves. Like, oh, as it comes up, as whatever problem arises, they don't really, especially if they're away from home, they're certainly not going to have a established care with a PCP, probably, in
Right.
a new city or state. So yeah, all great points. So now that we've kind of talked about the great opportunities, are there any challenges that you can think of? I mean, obviously, we've also touched on some of the challenges, keeping up to date with it, making sure that you understand the scope of practice in your state and whatever, is allowed, and operating under CLIA waiver if needed, if that's the route you're going, and making sure that you have that and everything in line for that certification. Um, what about any other negative or challenges that you can think of that we need to overcome in
I
this
wouldn't
space?
say necessarily challenge, but I would just say to be aware. So different states have different regulations for reporting STIs to public health. And
Mm,
so if you
great
do
call
have,
out.
especially if you're doing like a test to treat, right, where someone's coming in with the positive and you have that
Hmm.
test to treat where then you can, under a CPA protocol or whatever practice laws within your state, you can prescribe a treatment for that STI,
Hmm.
then you should also
Have to
just make
report
sure
it.
you know your state laws that sometimes you do have to report these to public health.
Yep.
And so also letting the patient know upon that, that you
Hmm.
will have to, if you
Report it.
undergo this, that you'll have to be reporting it.
Yeah.
That's one thing.
What
These
about
especially, oh, go on.
I was just going to say, we don't have to talk about specifics because that would get into bias and everything. But have you heard about cost? Like, are these cost effective, or are they fairly expensive?
Yeah. So, I mean, I was looking at some of the costs of them. And again, I think it just kind of,
It's going to
it
vary.
really depends and it varies. Because I also, so behind the scenes for someone who does a lot of test to treat and point of care testing and working with pharmacies to get that up and running, I'm really familiar with the cost of some of these tests before they went home tests. And I was like, oh my gosh, how is anyone ever going to afford that? But they've
Mm,
actually been pretty um, pretty reasonable. So for the blood test for the syphilis, for instance, over the counter, I've seen somewhere around, and again, like I'm not price, but I'm just saying, like if
yeah.
you probably Google this, you're probably going to find about $30-ish, which isn't
Okay.
bad.
Oh, okay.
And then the Visby medical that I've seen over the counter, like through their app, it's about 150.
Okay.
So, but if you think about that, if you have a patient that has, maybe a high deductible plan or, uh, you know, health spending account, and that's not covered, and for a lot of them it might be covered as a preventable, but if
Hmm.
if it's not because it's a lab or whatever, that might be a much more economical and cost effective, even by going to the pharmacy and then getting a treatment.
Yeah.
It might be more economical than going in somewhere. Although I will say too that a lot of public health departments do offer that testing for
For
free.
free.
So there
Hmm.
again, just be aware. That's another thing you can do as pharmacy. Just be kind of aware of the resources in your community, in your
Yep.
area. I know some states even some college campuses will they have numbers or contacts you can, and they'll get a test mailed to them for free through like grant funding or through the state
Mm-hmm.
funding as well. So if you
Hmm.
ever have a patient that is interested and can't afford that, I would
Yeah.
recommend to reach out to some of those, like a local public health or a state public health department, to see if
Yeah.
there's any opportunities for that.
That's great. And we always, I feel like I always give a call out to our community health worker program and the fact that
Yeah,
if you have a technician cross-trained as a CHW or a community health worker, they're going to know what the ins and outs are in the community, the opportunities, the different, ways in which they can get a patient connected. So that's something else. Yeah. You know, and also we were talking about pricing. When doing comparisons, it also could be, how much is someone willing to pay for the ease of it being on their time? Like, what if it's a Saturday evening, or what if they're going out of town and they don't have time to go get lab done and then whatever. And so that whole buying the test and doing the telehealth and filling their prescription, or, doing it in-house with you if you have a collaborative practice agreement to treat, it could be worth it to them because for whatever reason, timing and such. So
100%.
yeah. Okay, well, last thing before we wrap up, next to last thing, I'll ask you this, and then I'll ask you the very last question. But before we do that, I know just from your expertise, so I want to pick your brain on this. As you mentioned, you've been involved with getting test and treat stuff up and running and everything. One of the biggest pushbacks we always hear, and I totally get it. I've been there. I've owned a store. I've worked in, for other companies. I get it. Timing, like I don't have
Yep.
time. I just don't have time. I don't have time to do this. Do you have any nuggets or any tips or tricks about how to work in these types of things? Like if it'd be so easy to just see someone out there, they figured it out, they purchased it, whatever, just let them walk because they probably know what they wanted anyhow. But,
Yeah.
how can we see those instances, take advantage of them, and really, really make a time for that? Any kind of tips and tricks on that?
Yeah, I would just say that first of all, these are at-home tests, and so you're not doing the sample collection.
Mm-hmm.
And so that typically is what can sometimes,
Take
depending upon
time.
the type of test, but that can take time.
Mm-hmm.
The patient's, information, or, whatever, intake forms or whatever like that could be time to develop, or patient educational materials. There have been actually, it was actually not too long ago, but it was through the University of Pittsburgh, and I had come across, I love toolkits. I'm a toolkit junkie. Like I absolutely love a good toolkit for
Yeah.
pharmacy, and we've done a lot within our center for helping pharmacies and toolkits and kind of giving everything they need.
Mm-hmm.
And so the National Association of County and City Health Officials actually did a collaboration with pharmacy on STI treatment. And they actually have available a complete toolkit for pharmacies. And so you can
Mm.
have like printable materials for some of these. It's all publicly available because it was through a federal grant. Um, and it was with the University of Pittsburgh as well, but testing, and has educational material. So there, it even has a patient intake form. So if that's something that's,
Wow.
I have a lot of pharmacies I've had get kind of hung up on that a little bit. I've worked with, it's like, oh, well, how do I collect the information, and how do I, oh,
Mm-hmm.
like, that just
Too
seems really
much. Yeah.
overwhelming, and
Yeah.
it can be
Mm-hmm.
really a lot. And so why recreate the wheel when there's some of these really great resources
Love
that are
that.
out there for you? So it's a tidbit, I would say. Put that in the back of your
Yeah.
pocket, if you're ever
Love it.
interested in that. But also, as you mentioned too, of really relying on our partners, of like our community health worker or technicians, of getting that information, gathering that information, and really after that, if you're just answering some questions for the patient, which we do anyway, and that's part of our normal workflow, as well as prescribing the treatment and counseling on the medication, it's really,
Not
I
that
would
much
say
more.
it's not much
Mm-hmm.
more than a prescription, a
Yeah.
regular prescription, and you're probably going to make more money on it. So to
Mm-hmm.
be honest with
Yeah.
you, and unfortunately, in the way that things are right now in the world
Yep.
of pharmacy and reimbursement.
Yep. No, totally makes sense. That's exactly what I wanted. I love the idea. I'm also a nerd and a toolkit junkie. So like
Yeah.
anytime you can get like I still like to print things. I know it's not great for the for everything for environment, but I love to like hold something and like open
Hmm.
up a package and get all my goodies and everything. So yeah, I'm totally with you on that. I love that idea. So tell us again who the tell us again where that kit can come from. Sorry.
Yeah, so the kit came from the National Association of County and City Health Officials. So that was
Got it.
the granting partner. And then it was from, and maybe some of your listeners even here are familiar with that, but it was also from the University of Pittsburgh School of Pharmacy was a collaborator on that. And
Great.
they have an article in the Journal of American Pharmacists Association on that toolkit development and some really great resources. So shout out to them for doing an
Yeah, it's
excellent
great.
job on that and providing a resource to pharmacies. I love it when um, people do great work and they share that with
Share it. I
others.
know.
I
That's what
love
I was going
that.
to say. I love when, again, there's no reason, like if they took the time and created the wheel, I love when they share it because there's no reason for us to recreate it. So it's great. Awesome. Okay, well, final question now for sure. As I always like to ask our guests, the name of our podcast is Game Changer. So, Elizabeth, what do you think the game changer is here? What's our overall take-home point from today's episode?
I think the overall game changer is that our rising STI rates in the US are a public health concern. And for the first time, we have accurate at-home tests with immediate results for our patients to help increase access to treatment and increase access just to screening in general and prevention of spreading of disease.
Mhm.
And I also think that it's another opportunity for pharmacy who probably wasn't doing, you're not going to be doing probably a vaginal sample collection in the pharmacy, but now we still have an opportunity for a test to
Be
treat
involved.
now with this
Hmm.
because we have an at-home test.
Yeah,
So
yeah.
I think that's definitely a game changer for us. Just one more way for us to help improve the lives of our patient and increase public health.
That's great. That's great. Well, thank you so much. All that we have time for today, Elizabeth. Thank you so much for spending your afternoon with us. I really appreciate it.
Yeah, absolutely. Thanks for having me. It's always a pleasure.
If you're a CE Plan subscriber, be sure to claim your CE credit for this episode of Game Changers by logging in at CEimpact.com. And as always, have a great week and keep learning. I can't wait to dig into another game-changing topic with you all next week.